7. High quality CPR for an adult includes performing B. Hard and deep compressions. Clark, you're answering. Wow, he's good. Good. If you, that's good. High quality CPR. I need all of you to answer, so that'd be great. All of you to get it right. High quality CPR for a child includes performing
D.
D, very good. At least 2 inches. I don't know if I covered this. Infant care would be 1.5 inches, so that's D like David. You're responding to a shout for help from the lunchroom. You find a frightened coworker attempting to calm an anxious visitor who is making a high-pitched whistling noise between frequent hard coughs. Your coworker shouts, "Hurry, she's choking on a hot dog. She was just laughing a second ago." The scene is safe. You've taken standard precautions. Your facility's EAP has been activated and EMS is on the way. You should.
C. Wait, they're coughing.
If you said A, you're correct. She encouraged them to keep coughing. So they are coughing. They're not choking all the way. Yeah. You are responding to a request for first aid assistance in a cafe. You find an anxious server attempting to calm a frightened young child who is coughing weakly and is not able to speak. The server shouts, "He's choking on a peanut butter sandwich. Please help." The scene is safe. You've taken standard precautions. EMS has been activated. You should. D. Give abdominal thrust with the intent of dislodging the airway obstruction. This is for infant care, so she's choking on a jigsaw puzzle. The scene is safe. The EMS is on the way. Infant is not making any sounds. This is where you give 5 back slaps with the intent of dislodging the object. So basically you're taking the baby into your hand and on your lap, on your knee, and then you're just doing 5 back slaps to get that object out. Again, we don't have babies, so we don't. So the Good Samaritan is defined as a person who voluntarily renders aid to another in distress with no duty to do so. You are a trained first aid provider responding to a workplace emergency alert received on your smartphone. You are a directed person who is snuck by a nail from a nail gun. You've seen it safe. You've taken standard precautions. EMS has been activated. You have a first aid kit. The person is responsive, breathing, and holding their leg in obvious pain. You ask, "May I help you?" The person says, "Yes, please. I shot myself. I'm bleeding." The legal concept allowing you to provide first aid in this scenario is called what? Express consent. All of you should have said B. All of the following are life-threatening situations where quick action by a provider is essential except tenderness and smelling. Good. You are providing first aid for a person who overdosed on opioids. The scene is safe. You've taken standard precautions. The person is unresponsive. EMS has been activated. You have an AED readily available, but no naloxone. The person is breathing normally. What should you do? Put them in a recovery position. Yep. You are providing first aid for a person who has suddenly lost consciousness. The scene is safe. Taking standard precautions. This person quickly regained consciousness and is now responsive. EMS has been activated. You have an AED and a first aid kit readily available. The person is breathing normally, consents to first aid, and says, "I was hot, dizzy and hot. There was no apparent life-threatening conditions present." While waiting for EMS, you perform a secondary assessment. An important element of a secondary assessment includes what?
B.
It includes B, looking for any signs of why they're doing it. So looking for medical or jewelry. Or tattoos or something that signifies why they did that. You are a trained first aid provider responding to a wireless emergency alert for a worker injured by a circular saw. As you reach the scene, you see a person sitting on the ground holding a bloody hand against their chest. The scene is safe. You've taken standard precautions. The person is responsive and consents to first aid. Blood flows continuously from a deep jagged tear across their palm and wrist. You have a first aid kit with the 10-pack of sterile 4x4 gauze sponges, but no hemostatic dressings or a tourniquet. What should you do? Apply the sponges on the wound and push down hard. So, put your gloves on first, and then shows signs of shock and there is no difficulty breathing, keep them lying down, face up, cover them to help maintain body temperature. If it is wet or cold, place a water-resistant cover beneath them if available. If they complain of thirst, you give them what? A, nothing to drink. You are a designated first aid provider responding to a work site emergency alert for a person who with trouble breathing in the cargo terminal. The scene is safe, you've taken standard precautions. The person is responsive, perspiring heavily, anxious, and breathing rapidly. They consent to first aid. The person says, I just can't catch my breath. I've got a dull pain on my chest, but I am not having a heart attack. EMS has been activated. Another first aid provider is bringing an AED and a first aid kit. What is he having? What's happening to him? Say it again? He's having a heart attack. So what did I teach you to do to give a person with a heart attack? Give them an aspirin. So D, encourage the person to take an aspirin if they don't have an allergy to it. So the memory aid fast for stroke recognition stands for F is what?
Face.
A is what?
Arms.
S is what? T is what?
Time.
Good. If a person with suspected heat stroke is unresponsive and breathing normally, the most important action a first aid provider can take is to begin immediately cooling with the resources available. It will help regulate their body temperature and their brain won't swell. Signs of hypothermia include shivering and altered mental state. You are a designated first aid provider responding to a request for help over your two-way radio for a person stung by yellow jackets. The scene is safe, you've taken standard precautions. You see a person sitting on a picnic table. The person says, I stepped into a yellow jacket nest, I got stung in the face. The person's lips and face are rapidly swelling, they are wheezing and coughing. They consent to first aid. EMS has been activated. You have disposable gloves and a first aid kit. They carry an EpiPen but don't remember how to use it. What should you do? Give them the EpiPen. Yep. A healthy lifestyle combined with a commitment to safety at work, home, and play.